Hi, my name is Alex. One of the things that we've helped a lot of doctors do is answer a simple question: how do you get more surgery patients? In this case, specifically more weight loss surgery patients. At Google, there's over 472 million search results. Some doctors are able to show up on top and they get lots of patients, where other doctors don't show up as much. One of the techniques with Google that's very effective is using landing pages and optimizing for specific types of surgeries. Now, this is something that a doctor would do. Normally, somebody would type in best weight loss surgery or best weight loss surgeon, or they might even specify like surgeon in Dallas. Now, this is where some companies get the best results, is from the maps. Now, Google is very effective, but not when you do it poorly or it's not set up and managed well. And so when you start driving traffic to a page like this with other companies' advertisements or information that doesn't make sense, this type of page is not nearly as effective as this page, but you may want to send different keywords to different pages to get a better outcome. So I've shown you 3 different landing pages. One of the things that's really important with weight loss surgery and tracking is knowing where your patients come from. Here's a call tracking report. We're analyzing how positive or negative the sentiment are. How many phone calls does it take to get completed sale, or in this case a booking of an appointment. Down here we have phone calls. We can see they're coming from Google, and then we also have transcriptions. So we have transcription of the phone call to know exactly what the patient is calling about. Now, Google is very effective, but it can't work on its own and get great results. To get some really great results, we typically layer on Facebook because the demographic targeting is really good. If you notice at the top, we have places, so local places, then we have events, then down here we have content and photos. Facebook is far more effective than Google for one simple reason: you get the same amount of results for far cheaper. Now, Google is effective, and we see phone calls and we are able to see calls coming in the tracking, but we notice that the cost per phone call or the cost per booking on a Google patient is typically 5 times more expensive than it is on Facebook. So you can show up at the top with the ads, or show up in the maps, or try to show up in organic to get more patients, and that works. But when you do Google and Facebook together, that's what really gets the best results. Now, there's different types of procedures. So sometimes the patient looking for weight loss surgery, other times they know the specific type of procedure that they're going for. So if we go back to Google, and then you'll see patients asking questions like, how much is a sleeve surgery, right? And then you have ads coming up. The keyword is really important to the motivation of the patient. And the deeper they are, they'll go, how much does it cost? How much does it cost with insurance? Can I get it without insurance? Can I get it with Medicare? Can I get it with Medicaid? All of these keywords make a big difference on if you're going to get a quality click or not, and whether or not you should pay for that. And then, depending on which page you send it to on your website, will radically alter how many people respond. So if you have a simple page versus a more in-depth page with lots of videos, these things make a big difference on how many surgery consultations you're going to get. From there, this strategy is really important on the intake. Once the call comes in, having a very clean process to get the person to talk, fill out the information, and then get them into the office. So here we see a call talking about Medicaid and information like that. This is where the tracking is so important. You cannot manage what you do not measure. What's measured can be improved. If you're trying to get more patients, cash pay patients without the surgery, the tracking is absolutely essential to the performance of the campaign. If you have any questions on this or would like to know more, send me a quick email. I'll be glad to send you more information.